Okay, well, hi, everybody. My name is Miranda Hess. I'm from Lehigh County Administrative Entity. I'm co-facilitator of the Lehigh Valley Supporting Families Collaborative, and I will let my co-facilitator introduce herself, and then we will introduce our presenters for tonight.
Hi, everyone. I'm Emily Gonzalez Brown. I'm from Northampton County. I am Miranda's counterpart for the collab. Thanks all for being here. And tonight we have Magellan. We have John and Danielle here, so I'll let them take over and introduce themselves and get started.
Hi, everybody. My name is Danielle Delina. I'm a clinical manager here at Magellan. John?
Thanks, Danielle. Hi, I'm John Lees. I'm the member and family advocate for Lehigh, Northampton County.
So we'll just go through and share our agenda for tonight. And ahead of time, I'm just going to apologize in case anyone hears my dogs barking. I do apologize for that if it happens. So for today, we have an agenda. We are going to start by providing an overview of what Magellan is, what our role is, what we do. And then I'm going to go over some general information about behavioral health services. So speaking about sort of the continuum of services from outpatient all the way up until a hospitalization. Then we will spend some time talking about how you can find a provider. So if you or a loved one are looking for a specific behavioral health provider, we are going to provide information on how you can go about doing that. And then finally, we are going to end with just some questions and answers. This information today, please remember, is very general. It's sort of just a higher level overview to give you kind of a broad understanding of what we do for Magellan and behavioral health services. But if you have more specific questions, certainly we would be happy to answer them either throughout or at the end. So Magellan Behavioral Health of Pennsylvania. Magellan is Health Choices, Pennsylvania's medical assistance managed care program. So when we think of Health Choices in the state of Pennsylvania, the state's Medicaid program, we manage that Health Choices program. Magellan is a behavioral health managed care organization. We support and manage Health Choices benefits. Really what we do is try to get members connected to the most clinically appropriate behavioral health and substance use treatment. We do a big part of what we do is also review treatment requests to determine if medical necessity criteria is met for that particular treatment request and that particular level of care. And overall, I would say in addition to that, a big part of what we do is really direct support to our members. So our members, whether that's youth, whether that's adults, really just in making sure that they can get connected to the services that they need, helping them find providers, answering general questions. I think we certainly get a lot of outreach from members with all sorts of questions. The majority, I would say, are related to behavioral health treatment services and how to get connected. But there are plenty of times, and I'm sure John can speak to this too, that we get questions as well about how do I find housing resources in Lehigh County? And sometimes some of that is just really relying on our knowledge of our other system partners and getting the member connected to other resources within the community as well as best that we can. So Magellan serves 5 different counties, which includes Bucks County, Cambria County, which is in western Pennsylvania, Lehigh and Northampton counties, as well as Montgomery County. So we'll spend some time talking about Health Choices levels of care. So again, when we think of the state's Medicaid program for Pennsylvania, we call that Health Choices. And within Health Choices, there are identified levels of care through the state that we manage. Those levels of care are essentially on a continuum ranging from least restrictive to most restrictive or most intense. So as you can imagine, the most least restrictive level of care is outpatient therapy, outpatient services. So really these are, just as you would imagine, sort of an office-based visit where someone can go and access individual therapy, group therapy, and psychiatry. And so that is, like I said, when we consider the least restrictive, that's what we would think about would be outpatient services. Everyone is can access outpatient services at any time. Moving on from outpatient services, we generally move on and think of case management. So we often have case management providers that are, for example, embedded in larger outpatient providers, but the case manager is someone that partners with the member to provide some additional resourcing support. So for example, if the member needs some assistance in getting connected to housing supports, employment services, trying to understand and navigate public transportation. Maybe they need help finding a new behavioral health provider. A case manager is someone that can assist with that. Excuse me. Really, when we think of case management, we really think of linkage to community-based supports for the member. Moving on, we think of community-based supports. When we talk about those, we're talking about services that are essentially provided in the community, usually across all settings. So it could be in the member's home, in an office type setting, or in the community. Those include services such as IBHS services for children. So for example, ABA services, having ABA services, a team come to your house, family-based services. These can include DDTT, dual diagnosis treatment team services. So again, a team of clinicians that essentially can see and treat the member across all environments, but again, within the community. The member is still receiving those services, but certainly, and most importantly, accessing their local community while they're in treatment. Moving on from that, we have a partial hospitalization program. So a partial hospitalization program essentially is, when you think of a hospitalization, it's very similar to that in that it occurs in a agency type setting where a member will go, usually up to 5 days per week during daytime hours, for example, maybe about 6 hours a day, where they go for the entire day. And for a shorter period of time, they receive sort of a burst of really intensive treatment services within that partial program. And so those services could include things such as individual therapy, a lot of group therapy. Partial programs certainly do have, as you can imagine, you're getting a group of people together that are receiving behavioral health treatment. So there's often a lot of group therapy work that's done within that setting. They have access to a psychiatrist. Usually a psychiatrist is there on site, usually a few times a week at least. They'll usually eat lunch during the while they're there with other patients, and then sort of continue on in the afternoon with more groups, maybe more individual sessions, whatever it might be. And so again, this is really for people that I would say are experiencing a kind of more intensive mental health need, behavioral health need, but don't necessarily need a hospitalization. Beyond that, we have residential treatment programs. So these are often programs that people are probably most familiar with, residential programs for youth, but we have seen people, adults, access similar type programs. And then finally, hospitalization. So I'll talk a little bit more about each of these in the next slide. So again, outpatient services, therapy, medication management available to anyone at any time. Usually when someone is coming into behavioral health services for the first time, we usually see them start at outpatient services. Community-based support, as I said, encompasses case management services, IBHS or intensive behavioral health services. It can include peer support services, which is for individuals that are being supported by another person that has a lived experience with a behavioral health need. So rather than the way we think of, for example, therapy is with a therapist and a patient, peer support is much more on more of a partnering type of level. It's not really considered therapy, or I should say treatment per se. It's more of that partnering, working toward goals that the individual wants to work toward, but having a partner in doing so because that person may have also experienced a similar type situation and is now in a period of their recovery and can help and support other people. Family-based services, that's a program for children. And family-based services is our most intensive children's service in the community. So this is really intended to support children with more complex behavioral health needs, really to support them and their families in their home, and hopefully potentially prevent any type of further need for like an out-of-home placement. And then DDTT, or dual diagnosis treatment services, which some of you may be familiar with. We do have that program in Lehigh and Northampton County, provided by Medicaid. It's a very intensive community-based program intended for adult individuals that have an intellectual disability and also have, again, very complex symptoms that may require or have had hospitalizations. It may put them at risk for losing their community placement. So again, sort of higher level needs, and we want DDTT to provide that intervention, that crisis support that will hopefully help the member to stabilize, remain in their community, and sort of lead a more stable and happy life. And then, as I said, the community-based supports that I did just talk about generally can see the individual across all environments while that person is still accessing their community. They're still considered community-based, if you will. Partial hospitalization program, as I said, provides that scope of individual group therapy as well as medication management with a psychiatrist, is generally, though, considered short-term. So again, if someone presents with an increase in symptoms and they need something beyond what they're currently getting, maybe they're currently in outpatient services, but it's determined that they could benefit from a week or two of a partial hospitalization program in order to really help to stabilize those symptoms and prevent the likelihood of a hospitalization. We also see partial hospitalization as a recommendation if someone is being discharged from a hospital. Maybe the acute crisis need has been stabilized, has improved, but the doctor in the hospital feels that the member could benefit from 2 weeks of a partial program to continue their treatment in a more structured setting. Oftentimes a partial program could be recommended. As I said at the beginning, Magellan does also manage substance use treatment programs and supports members that have substance use disorders to ensure that they can access appropriate treatment. And there's really I would say, a range, a continuum of services under the substance use disorder umbrella that, again, similar to what we just talked about, ranges from outpatient services all the way up to hospital type services. Generally, if someone is looking to access substance use services, we always tell people that the first step is really going for what's called an ASAM assessment. So it's essentially a specific assessment that can determine, based on a variety of factors. So the individual's current use, their current supports that they have, their housing, whether or not they have any behavioral health needs, their level of motivation, sort of assesses a lot of different factors, their medical needs, and then from that assessment determines what the most appropriate substance use treatment would be. Residential treatment programs, as I said, often thought of for children. These are usually campus-based programs that provide very intensive, very structured treatment to the child in order to really stabilize very complex symptoms. But generally speaking, the goal is always to reunify that child with their family. So really get them in a situation where they and their family receive very, very intensive treatment for a short period of time with the ultimate goal of returning to the family and then again, accessing their community, stepping down to lower levels of treatment. We do have similar type programs in Lehigh and Northampton County for adults. We do have we have one crisis residential program that some of you may have heard of. It's in Allentown, called Robbinsbauer. It's a crisis residential program for adults that often can support adults that, again, may be showing an increase in their symptoms, may need more intensive treatment beyond what they're getting in an outpatient setting, but don't necessarily present as an imminent danger to themselves or others, so they don't necessarily need a full hospitalization. Rather, they may go to a crisis residential program where they would go, it's a 24-hour-a-day program. They might go for a week, maybe 2 weeks, again, where they receive a variety of different treatment services within the program. They see a psychiatrist, and then they discharge to return to the previous lower intensity levels of care in the community. And then finally, when we think of that, again, that highest level of treatment on that continuum, it's a hospitalization. So hospitalization occurs when an individual presents with an imminent an imminent danger to themselves or others. Generally, if someone is experiencing suicidal ideation or some type of very, very significant symptoms of psychosis, something that really makes them a danger to themselves or others, then they're assessed for hospitalization. Hospitalizations are usually very short term. The intention is really just to stabilize the crisis event that occurred that led to that hospitalization and then transition that person back to some type of lower level of treatment. It might not be a jump right back to outpatient services. As I said, it might be a short-term hospitalization, but essentially for them to continue their recovery in a less restrictive level of care, because a hospitalization it's on a locked unit, considered very restrictive, because again, the intention is really to help the person to stabilize through very quick and aggressive medication management, treatment, and then continue on in their recovery journey. I will pause there. I went over a lot of different levels of care questions for now. No? Okay. I'm going to turn it over to John now, who's going to talk a little bit more about how we find a provider. John?
Thanks, Danielle. And thanks to everyone for being with us tonight. Hopefully the information we're going to share and have been sharing is helpful. And we certainly encourage any questions, fire away. So, all right. So Danielle, as she mentioned, covered quite a bit of information related to the continuum of care. So those are the various services, and there's quite a list. As you could see, there's a lot of community-based services, which is a real asset in terms of the supports that are available. But what do you do if you need to find a provider? So you, or perhaps a loved one, a child is being recommended for a particular service. Perhaps it's outpatient, perhaps it's a partial hospital. Whatever the service is, we have a provider search tool on our website that can help folks independently search for provider options. And I should probably back up a little bit and let you know that we have a website. So it's magellanofpa.com is our website. And on there, there's a ton of information. I'm going to go over quite a bit of it actually this evening in the next few minutes. And again, if you have any questions, ask them, but I also encourage folks to check it out. There's a ton of information on there. And I'll go through some of the kind of key takeaways that I think are most helpful based on the experiences I have when I talk with members or families, and how they've benefited from the website. So, and so one of those things is our provider search tool. So it allows folks to independently look for a provider or providers, or provider options. And I'm going to point out to you exactly where it's located on our site and the various options you can indicate to really kind of fine tune your search. So if you look at the top, and I think, is that you moving the cursor, Danielle, or no? You can see there the main menu in the upper right. What is underlined is provider search. So it's very prominent on the homepage when you land on magellanofpa.com, because it's probably the most utilized page on the site overall. So if you click on that, you would then be able to search for a provider. And the way that it's set up is it searches by county. So the very first drop down you would see would be what county you reside in or where you're searching for a provider. And it was those counties that Danielle had referenced. So for example, here, it would more than likely be either Lehigh or Northampton County. And I'll also mention at this point, Lehigh, Northampton County, we have a shared network. And so because of geography being what it is, we have a lot of providers who service both counties, which can be very beneficial in terms of accessing the needed service. So once you indicate the county, then you can search by zip code. So if you can see here, this is the page it would bring you to. In terms of the provider list up in the upper left, you can search for mental health, you can search for substance use providers, and you can also search for intensive behavioral health services. And Danielle had mentioned that that's a community-based team service for children and adolescents, and probably the most utilized, Danielle, correct, in terms of the children's services overall, with the exception of outpatient.
Yeah, I would say with the exception of outpatient, IBHS for sure. We have the most of our youth members accessing that.
Right. So it's its own separate in the drop down. Once you select what you're looking for, which provider list you want to look for, then it allows you to search by zip code. So it starts with a 5-mile radius, and you can expand that out. So if you do a search for some provider, let's say outpatient in rather close proximity within 5 miles, and you don't have enough options or don't have an option, you can expand that out. You can go 10 miles, 15, and so forth. So that's the very first filter you can click on, which is the proximity. There's also some other things you can see there. Are they accepting new patients? You can check that box. Do they have any specialties? So if you click on that, there's a drop down of all the various specialties. So do they work with individuals with autism, someone who has an anxiety disorder, perhaps an individual who has a trauma history? So there's a list of specialties that the provider has indicated that they have staff that offer that specialty. And I should have mentioned, and I'll say it now, the information related to the providers, their address, their name, the specialty services they offer, the ages that they treat, all of those things you see there in terms of the filters is populated based on the information that the providers give to us. So, for example, accepting new patients. If they're not accepting new patients, we ask our providers, and we expect our providers to go into their portal through our website and update that information so that this provider search tool is up to date and accurate. I will be completely transparent. Having used it, I use it daily in assisting folks. And I've also gotten a lot of feedback from folks over the years that this has been in use. And it's not always accurate. And so that's why we work very carefully and closely with our providers to do everything possible to encourage them to keep the information up to date. So it's only going to benefit everyone within the system if they do that. A couple other things to point out. I mentioned it, things like what ages they treat. There are other things like location accommodations that could be not only the physical location itself and what they offer, but also their hours. So, for example, outpatient providers or other providers who may offer evening or weekend hours, you can search for that as well if that's a need that you have. So there's all kinds of filters you can put on. Once you've clicked the filters that you wish, it will return a search with any providers that are identified through the filter you've used or the filters you've used. Let's say hypothetically, it gives you a list of 5 outpatient providers. That would be randomized. So it changes the order. It doesn't put them in a particular order. And each time, if you did the same search with the same filters and it returns those 5, they're going to be in a different order. So it randomizes them in terms of the search. So that it's, we're not lifting anyone up to the top or to the bottom. This is how it got sorted randomly. So again, this can be a very helpful tool to utilize independently. I'm going to talk in a minute about how to connect with us directly. So if you're using anything on the website, this included, and you run into any difficulties, I'll be letting you know what our member services number is that you can reach out and get assistance in using this. If you happen to use this and you want to share feedback with regard to its accuracy, or if there's something inaccurate, that's always appreciated so that we can then follow up and improve the tool. We always want to be striving for continuous improvement. And so any feedback we get is always helpful. And part of my responsibility, and I'll talk about my specific role in a moment, is to gather perspectives from members and the families and loved ones of members and other system stakeholders who support members in terms of their experiences with services. And we're part of that. our website and that experience, that this is all part of that. So any perspective that we can gather from folks helps to shape the work that we do going forward. So that's a provider search tool. And again, we'll look for questions later if you have any, or have any feedback if you've used it. Again, good, bad, or otherwise, whatever you've got is very, very appreciated always. Okay, so moving on to another important page, which is community resources. This is one of the pages that is available on the site that directs folks to various supports, services, the goings on in the community. Our communications team and our entire team always wants to promote not just what Magellan's doing, but what's happening in the community. So we have a lot of partnerships. We're often involved within the community at various activities or events that are occurring. And we always want to make sure that if people are looking for information about those resources, they can find it on this page. So you can see there's a menu of the various areas that we kind of look at. I'll point you to the right under where it says community, the Behavioral Health Matters podcast. That's a new program that we have. I am the host of that program. I really enjoy doing it. We started just over a year ago. We just completed our 9th episode, which is going to post shortly. If you were to click on that particular link on the community resources page, it would take you to the Behavioral Health Matters podcast library. So you can see all the episodes. You can click on any of the episodes to listen. The goal of the podcast is, and I plug this wherever I can, because I really want people, if they're interested, to check it out and let us know what you think about it. If you have ideas for episodes and so forth. Again, we've been doing a little over a year, and the entire goal of it is to really promote the work that's happening, not just Magellan's work, but provider and different organizations and agencies. Our 8th episode, we're lucky enough to have Jessica McKinty-Nuttall come on from the ARC and talk all about the services that the ARC provide and kind of that intersection with mental health. So that was a fantastic episode. She was a wonderful guest and really able to tell a great story about the advocacy efforts that she and her team and the folks at the ARC do. So just an example of kind of the goal, which is to really promote what's happening in the work that's going on, but to do it in a way that's easily consumed. So if you're familiar with podcasts, it's audio only. You can listen. You can listen when it's convenient for you. You can stop and pause if you get interrupted, if you're doing something, and you can come back to it. So the reason that we started was we're always trying to connect with the community. And this is another way for us to use technology and a popular medium to get out there and hopefully connect and kind of get the word out. And as I mentioned at the top, any feedback, if folks have it, definitely welcome. Always looking to improve things. So that's the community resources page. The next page we wanted to highlight were the county resource pages. So as Daniel mentioned, we work in Bucks County, Cambria, Lehigh, Northampton, and Montgomery and Bucks. I said Bucks twice, I think. If you were from Bucks County, you could find information specific to Bucks County programs and partnerships and the goings on. And the same is true for Lehigh, which we have cited there. And I think our next slide is Northampton. What's important to see on this page is we have the links directly to the digital versions of the member handbook, which has all of this wonderful resource information. It has member rights and responsibilities. It has things about the physical health insurance companies. It's a very helpful tool. Every new member receives a handbook. So you get a physical copy, but the digital copy is here too. So whether you're a member, the parent of a member, or you work with members, this is a really great thing to have kind of bookmarked because it answers a lot of questions. I use it as a resource still after 20 years here because sometimes I get questions and I'm just not quite sure. Most of the time, if I go to the handbook, the information is there. You just got to go look for it, and it can be a very useful tool. The other thing I wanted to highlight at the top of the clickable links is the welcome letter that we send out as well. So every new member receives a Magellan welcome letter. And in there, it just gives some of the basic information. So, hey, here's the website, here's our member services number, and then some other key points of contact. So like my information is there if you live in Lehigh or Northampton. We have some of our clinical team representatives who act as single points of contact for folks listed there and how they can be reached. So we try to do that. We started that about 10 years ago, really as a way just to kind of orient folks to Magellan overall. It doesn't go into a lot of the services. It just provides those first few kind of key pieces of information that would be helpful to know. So I think that's it on this page, Danielle. And so this is the Northampton County page. Again, very similar. The only thing I guess I would say from county to county, there may be specific programs. So it's a health choices program. So many of the services are consistent across all of the counties we serve, and you would even find them in counties we don't serve. However, there are some programs or needs that particular regions or areas have that others do not. And so they prioritize that through things like reinvestment funds, which can be utilized to develop programs, enhance programs. And so that is something that the county and Magellan partner on and try to really understand the specific needs of a particular county and then do the work to try to bring that program into that continuum or develop that enhanced program or whatever the specific thing is. So from county to county, you might see some slight nuance, and that's typically based on county specific needs or requests. So important, how do you get in contact with us? So Magellan has member services representatives available 24 hours a day, 7 days a week. And this list of phone numbers is it's broken down by county. There's really no wrong door. If you called any of them, they would get you either the answer you need, the information you're looking for, or they would connect you with a resource, whether it be a clinical care manager, if you had a clinical need, or someone that can get you the specific information that you're looking for. Again, they're available 24 hours a day, 7 days a week. Some of the things that they help with are to provide, to give out options related to provider requests. So my child was recommended to go to outpatient. Can you give me some provider options? Now, as I mentioned, we have the provider search tool, but if someone didn't know about the provider search tool, they will always recommend and encourage folks to check it out, but they'll give them provider options as well to help kind of get them started. So again, they're there 24/7. There was something else I was going to say about them, and I'm completely blanking on what it is. It'll come to me probably.
I
as
was
soon
going
as
to
we
ask you,
disconnect.
John. Yeah. I feel like our customer experience associates will definitely do their best to try to answer as
Yes.
much of the questions as they can, certainly depending on what it is. But whenever there's kind of a need for additional detail, a clinical question, just really any need that would sort of require more of a discussion with a care manager, they will happily get you connected to, as John said before, usually there's a single point of contact. So if, for example, the individual is in a certain level of care and they already have a care manager assigned, it'll go to that person. Right. Or if they are not in any level of care and otherwise maybe just in Lehigh County, we have a dedicated care manager for the children's team and a dedicated care manager for the adult team that handle those calls and are well versed with all of the resources within those counties and for that particular, whether it's for adults or kids. And so that's certainly always an option. Our care managers take a lot of calls throughout the day.
Yeah, thank you, Danielle, for adding that. The other thing I was going to mention is sometimes we require releases of information. So, what Magellan does falls into healthcare, and we have records, of course, for any members and potentially treatment if they've accessed treatment. And so there are times, well, whenever we get a call, we always have to validate whoever the caller is. Is it the actual member or is it a parent or guardian? or another representative. And so there are times where we might need a release of information in order to be able to speak to a different entity. And we have electronic release forms on our website that can be completed right there on the site by the individual or the parent or guardian of an individual. And there are times where the member services representatives will get calls to help navigate to the release forms, or if someone has difficulty completing the release forms. So that's another area that they can assist with. And again, as Danielle mentioned, if needed, they could escalate that if it went beyond just some of the basic information. So they try to triage the call, figure out, can I answer this question? Can I get them the information or resource they're looking for, or direct them correctly? And if not, do they need someone on the clinical team? Are they looking for some other information that I can get them connected with another individual at Magellan? So they're kind of assessing and triaging and really trying to help people to be independent. And from my experience and the feedback I get, I think the vast majority of people who are calling have tried in some way to kind of get the information they're looking for, the question answered, and want to be independently accessing the services and moving forward. And so our role really is to make sure that that can happen. And so we can be engaged as long as needed or for as short as needed. It really is very individualized depending on the caller and what the needs are. So then you can go to the next slide. So this is my information, just gives you a little idea of what I do. So again, as I mentioned, the member and family advocate role really was dedicated to be for the members and the families of members and the community to be engaged with folks who are needing help navigating services, getting connected, or if they're in services and having difficulty with their service provider for some reason or another. And then to take information related to the feedback that we get about member experience, pivot to Magellan and say, we're doing pretty good with this, but we need to work on this other thing, because I track all of the contacts I have. So I have data that tells me that I got 8 calls last month about this issue and whatever the issue is. And so I can work with the team at Magellan to try to address that issue. So we're very data driven. So we look for trends. We don't necessarily need to wait for a trend. If there's a significant issue, we'll take action as quickly as we need to. But I'm very fortunate that I get to work, directly with our members and the families of our members, but also with a great team at Magellan and the counties, to be able to assist folks, understand what their experiences are, share the perspectives of people who are actually utilizing the services. If something is good, that's helpful. If there's a problem or something could be improved, that's even more helpful to shape the work we do. So that's kind of the primary role I have. I get to do a lot of other stuff as well. Like I mentioned, the podcast, which I really enjoy. And really the overarching goal is to be member focused, member centric, so that folks in our office are aware of what's happening out there. So you see my contact there. That's my direct number. That's my email. I encourage people to reach out with any questions, concerns, direct others to do likewise. I work oftentimes with other system stakeholders. I mentioned the ARC, school districts, providers, the county, various county departments. So yeah, so it's there's no wrong question. There's no wrong door if you reach out, and I'm not necessarily the exact right person, kind of like the member services representatives I mentioned. I try to triage what the issue is or question. And if it's something I am not the right person directly, I'm going to try to find who that is and get you connected to the right person. So, so that is me and my role. And so we'll stop here with providing the information, and we'll turn to you and see, do you have any questions or feedback?
So if anybody has any general questions, feel free to ask those now while we're recording, because those are often really helpful for anybody who might be viewing it at a later time. However, let me know if your questions are more individual specific, and I will go ahead and shut the recording off.
I have a question. I met a parent that they think their child has autism. So to get involved with Magellan, what kind of documentation do you require for them to talk to you and for you to help them? Like you need a psych eval?
Yeah, so if the family that you're speaking about, if the member is eligible with Magellan, they can really call at any time and be connected with one of our care managers as a first step. If there is an understanding that there may be autism, then we, as I said earlier, we do have dedicated children's care managers, particularly children's care managers specifically that work and support autistic members that they would be connected with. And so depending on what their need is, they can certainly walk them through what those next steps would be. If there is a psych eval or how to get connected to whatever type of evaluation would be needed. And then if supports are recommended, treatment services, that would all sort of be explained in kind of those next steps. But I would say, yeah, probably best to just really have them call and kind of let the care manager know that they're really just kind of starting on this journey and looking for some direction on what to do next.
And if I could,
Thank you.
if I could add to that answer, Danielle, and we didn't have this on our website page screenshots, but we actually have an entire page dedicated to autism and autism services. And on there, we have, so I'll back up. We have in Lehigh, Northampton County, a wonderful committee called the Autism Action Committee. So that is a Magellan and county partnership and collaboration along with parents or individuals with autism was started about 7, 8 years ago. And the charter of the committee is to identify service gaps or needs within the community and try to address those. So one of the things we did years ago, one of the first things we did was we built a navigation guide for families. We're actually in the process of updating it, making sure everything in there is accurate and make any revisions we need to. So that first guide was the family navigation guide, and that's really for folks on the front end. So maybe someone who has a child who's newly diagnosed or not yet diagnosed, but maybe, the family has been recommended to investigate that further. And just as a representative of the committee, we had these grand ideas to put this big resource guide together, and really the families on the committee said, we really don't need all of that. There's a couple of really key pieces of information we need. And then if we had like a resource appendix, that would be the most helpful thing. So it really is intended to provide some of those basic first few steps, things like insurance coverage, getting that assessment or evaluation done, and some of those key kind of first few steps in navigation. And then it has a resource listing. 2 years ago, we then identified that we had another population we wanted to address, which was transitional age individuals with autism, kind of 14 to 25, 26. And so we worked again with the committee to put together a navigation guide for individuals who are in that age range of 14, 15, 16 and above, really looking at things like housing, education, vocational, social, like all the different domains, and identifying important information for our area, but generally as well, and then that same kind of resource appendix. So that's another potentially helpful tool for folks in terms of, what are the steps to take. It's not necessarily Magellan specific, it's more, system-wide specific, if that makes sense. So I just wanted to throw that in there as well. That family navigation guide might be helpful, in a situation like that in terms of what do I do first?
Mm-hmm.
Other questions?
Yeah, I was navigating the website. I think if you're not a member, do you have access to the resources John was talking about, like the podcast?
Yes. Yeah. So it's a public site in terms of our information. To receive services, you would be a Health Choices member, so you would mean that either the adult or child had applied for medical assistance and was determined eligible under the Health Choices program. So they would get set up with a physical health insurance company to manage their physical health needs, and then a behavioral health company. And in those counties that we referenced, Magellan manages those behavioral health and substance use benefits for those individuals. So for the services specifically, you'd have Magellan coverage, but the podcast and all the other resources related to what's going on in the community, yeah, I mean, it's really anyone can access that, and that's a good thing if people do.
Yeah, and I would say all of the resources on our website, anything that you can access, even the autism guide that John just talked about, the podcast, just a whole bunch of various information, community-based resources. Yeah, you can certainly access all of that.
Yeah.
So can you navigate me back there again? I'm on the website. It's
Yep.
Is it under providers? No. Oh, home or members page or?
So I will start from home. Can you see my screen again?
Okay. Oh, I wish yeah, okay.
You got it.
Mhm.
So I personally I searched autism, but John, I think it's under
So if you go to,
service. Go ahead, John. You tell me.
sorry, if you go to members page and you're looking for autism, right? The autism page that we're just on.
Yeah.
Yeah. So then go to, is it services and programs, I believe? Yeah.
Yep. So
And
it's
that's
down at the
where-
And
bottom.
then, yeah, you see service and programs, the first one, they're autism resources.
Yep.
And it should populate
Yeah,
now. And if you
definitely want to check out the podcast. I work with individuals with autism in helping them get jobs. Always like to be well informed.
Yeah, and the podcast is, if you go to members page, and then I think that's under community. Should be under community. So same
Yeah.
thing, you start on members page. I think it's
Community.
community. Yeah.
Oh, okay.
And then if you
And then
click on
right there.
that, yeah, it'll give you the episodes. And it launches, once you click listen here, it launches to our YouTube channel, which is where all the episodes are housed.
Thank you so much.
Yeah, very welcome.
Any other questions?
We had one in chat. It was, would a child lose benefits if county programs are helping in likely the same areas, for example, CASP?
Oh, no. So if I understand the question correctly, you're saying that if there is a different county system that's helping in one particular area, does that essentially preclude them then from getting support from Magellan? If I'm understanding that correctly.
Correct.
So no, not necessarily. I will say eligibility for within Magellan is determined at the county assistance office level. So when someone applies for medical assistance benefits, that process is what then determines if Magellan is their managed care organization. And so we then, as John said, manage those behavioral health benefits. And so there are often times that an individual is receiving services through a different type of county program that might not be funded under the umbrella of Magellan, but we're instead funding and supporting them as they're accessing behavioral health treatment. It really just depends. But just because you're accessing a county program doesn't make it so that you won't have Magellan. That's really just based on determination for medical assistance.
So we have an adolescent that we're trying to help the family with, where they're receiving Cass County services for a specific behavioral issue, and they have a specific agency that it's funded through Magellan. So there is a conflict of scheduling, and they don't want to schedule the child because of that reason. So that's what has me a little bit confused, because the funding of the therapy it's not paid by the Medicaid portion, nor Magellan, but because they are funded through Magellan, all of their services pretty much and all of their patients that they have are Magellan patients. the billing seems to get confused, and now they're refusing services to the adolescent.
You say that provider in particular is refusing
Correct.
services to the
The
adolescent?
agency,
Okay.
yeah, the agency. They offer, it's a service agency that offer different types of behavioral therapy. So the child is receiving individual therapy through Magellan on his own through the doctor, but then the family function therapy itself comes with that county grant, and they seem to like overlap. The billing and the provider are telling family that it's considered double dipping, but it is my understanding that it's not.
Okay. Yeah, I mean, that's a really good point. And I think there is always sort of a consideration for what would be considered duplication of service, right? That does certainly come up in our field quite often. We, want to be sure that from a clinical perspective, someone is accessing one treatment, that it's not counterintuitive to have two different providers, for example, providing the same service. But in this case, it sounds like there's probably a lot of other details that would need to sort of be talked out. I would suggest that you encourage them to call Magellan and ask to speak with a care manager on the children's outpatient team. So if you specifically ask for a care manager on that team, that's going to be the best people that can help you kind of talk through what the current situation is, and then just help to get a better understanding of kind of what should happen, what next steps would be, things like that. So I think, yeah, best connection would be with the children's team, care management.
Would an advocate be able to call with the family? They're Spanish speakers, so there is also that language concern.
Yep, we also do provide
Mhm.
interpreter services as well. So if a member is Spanish speaking and they call, we can certainly we work with an interpretation agency that we would definitely loop in, so that way we can still communicate openly with the family, certainly. But
Thank you.
if their preference is to call with someone else, they can. But yeah, we can also offer that as well. Any other questions?
So one question that we hear a lot, I don't want to say a lot, occasionally from families is just about waiting lists that, they have a recommendation for example, IBHS, and they call around to different providers and, they're being told that every provider has a waiting list. Is there any steps that those families can take to try to access services?
So John, I'll have you jump in here too, but so I do know that the children's outpatient team does receive, it's sort of a survey that all of our IBHS providers submit to us that indicates what their availability is. So availability for everything, so BHT, whatever it might be. And do they have daytime availability? Do they have evening availability? How long is the waiting list? And so we get that on a recurring basis. And really that sort of is what we rely pretty heavily on whenever we get member outreach to help get connected to a provider. But John, that's generally just accessed if a member calls, and then the care
Correct.
manager can walk them through that, right? We don't have that
Yeah.
posted anywhere, right? Yeah, so it would just be a more.
We don't, but when I get calls and people, we can add people to the distribution. So that could be anyone essentially getting the distribution from, I think,
Might
Liz.
be, actually might be helpful, Miranda.
Yeah.
Yeah, I'm
So
just thinking
it's
if
the
you guys want
1st
to
and the
put it in.
15th. It is as Danielle mentioned, it's a survey that the team sends out, and then the providers respond. This is what we have available or not. Now you're right, Miranda. Unfortunately, the way that the kind of current landscape is, and it's been this way for a while. We've actually increased the size of the network. So we have more providers providing IBHS and ABA than in years past, but we also have a lot of kids using the service. So it's tight. It's difficult. The reality is it's hard to get connected. If what I tell people is call it, like, I hate to think someone's out there calling on their own, and unfortunately, a lot of the calls I get are families who have been trying for 6 months, 7 months, 8 months, trying to get hooked up, calling our provider agencies, and then they reach out, when someone suggests that they do that. It's not as though we have something magical we can do, but now they're on the radar and we can stay engaged until they're connected. So it still may take the same amount of time, but we might be able to lift some of that, the task they've been taking on, which is calling all the provider agencies to see where they are on the waiting list, or do they now have availability. We can actually hook in with our clinical team. I work closely with them a lot when these situations come up, and remain engaged with the family. So at some frequency, some interval, we're reaching out, or they're reaching out, whatever works better for the family, to get updates, to give updates. Where are we at? Do we have you had a, connection made or not? So then we continue to try. And we use those reports to really kind of, target who we're reaching out to. And our clinical team talk directly with the providers. So that's who I always loop in. So if there are providers that show up on the list, those are the care managers I tend to reach out to, because they may have some availability, and it's helpful to get the right people talking. So those lists have not only the provider and their availability, but it also has the key person for contact and their phone number and email. So that's also helpful, not just for our teams or others in the community, but certainly families who are, maybe in some cases folks want to reach out independently, but they've been doing that and they're just looking for a little more of that kind of targeted, who should I be calling? So yeah, but you're right, Miranda, it's been a challenge. It continues to be a challenge. But the reality is, our responsibility is, if someone's in need of the service and it's been recommended, we have to get them connected. And I try to be very realistic, and I know the rest of the team does too, when folks reach out. And we also push our provider network to return calls, to pick up the phone, respond to voicemails. Even if it's a no, let the family know that, so they can, or us, we'll cross you off the list if you can't do it. Because again, it's really just about making that connection. So, yeah, hopefully that helps. I know that is a trend. It has been a trend. And, I think, if there's any one takeaway folks have, if you're aware of someone in that situation, please give them my information, give them the member services information, as Danielle mentioned. Kristen, who oversees the children's team,
Yeah,
her team.
that's what we're thinking, Kristen. Yes.
That's exactly what I'm thinking. This is what her team does. So, getting on the radar is not a bad thing. It certainly helps.
Yeah. Miranda, Emily, would it be helpful if I ask Kristen to add you both to that distribution? You'll just get that biweekly email that'll show what's available. Would that be helpful, or?
Yeah, I think that would be helpful.
Yeah,
Sure.
definitely. Like Miranda
Okay.
mentioned, it's kind of a similar issue with
Yeah.
Northampton County,
Yeah.
with the feedback we get from families. So
Sure.
Yeah, and it's, I mean, because we'll get a lot of referrals too, for like kids and really the families looking more for services like IBHS, but they don't really know how to access it. So then they'll call our office trying to, figure out how to get some services, and they think they have to go through the county. And then, we are working with them to try to work through all of those things. So I think it would be helpful, I think, for our intake worker to be able to provide that info.
yeah, same.
Sure, I can do that. I'll ask Kristen to add you to the distribution list.
Thanks.
Can you tell me what IBHS stands for?
Intensive, go ahead, John.
Intensive Behavioral Health Services. And actually, on the website, there's a video which talks, it's short, it's like 4 or 5 minutes, that we made a couple of years ago. And it's specific to IBHS services. So it's kind of just a 101, the basics of IBHS. I don't remember exactly where it is on the site, Danielle, but it's on there. And it's a really helpful, and that's why we made it. It's a really helpful video, just again, given some of those basics. We partnered with our counties to participate, a couple of providers. I was in it.
That's right.
I'm just laughing because I hadn't planned on being in it, was involved with the work
I
group,
know.
and then they say, hey,
I
you
do
get to be
remember
in it.
that, yeah.
But it does answer some of those basic questions, which, that's a good question. What does it even stand for, IBHS?
Yep. And it is under services and programs, and then under IBHS. So there's a whole bunch of information that really goes through the steps of everything that's needed for a request, and really these things are what we expect the providers to submit to us, but it does give, there's caregiver information, really just good recordings and things like that that provide an overview of IBHS. There is so much that goes on that we could do a whole training just on that. That would not be my area of expertise, I'm happy to say, but we could do a whole training just on it.
Because you had mentioned if someone is recommended that they get behavioral services, who would recommend that to the parents? The family doctor, or do they have to see a psychiatrist or a psychologist? What do they need to do before contacting you?
So my understanding, and again, I'm going to have John jump in, but my understanding is that through a written order, which can come from a doctor, a psychiatrist, that basically says this child needs this service. That's usually the first step, John. But then they usually get connected to a provider then that does the assessment that's actually needed to determine what the prescription is. But John, anything else you would add there?
Yeah, for IBHS, it's a written order as Danielle mentioned, and that can be done by any practitioner of the healing arts. So CRMP, it could be a medical doctor, a psychologist, psychiatrist. So that's for IBHS. And then once that written order, that's kind of a general, yes, I recommend this service and approximately this specific service. So within IBHS, it's a team. So there's different disciplines. So there's a master's level clinician typically, and then kind of a bachelor's level individual who delivers that kind of frontline service in it and the interventions. So it's a team. And once connected after a written order with a provider agency, they will do an assessment, which is done over the course of a few weeks. So that is kind of getting to see how the child and family operate in home, maybe at school, in the community, to really kind of fine tune what are the services that are needed here, how much of them, what frequency, where do we need those services. And then from there, the provider submits that to Magellan to get an authorization. For something like outpatient, the school might recommend that. It could be a guidance counselor. It could just be someone saying, I think I need to talk to a counselor, and they could outreach to a provider agency and set up an intake to get the ball rolling. So it depends on the service, I guess, in terms of how you access that. But if there's questions related to what are the steps involved, I was told I should get this service, or I was recommended that my child should get that service, let us know, and then we can kind of triage what was recommended and what's the avenue or the steps involved in getting connected.
Okay.
Yeah. But very good question.
So we have a question in the chat. If the student already has an IEP, oh, sorry, it's not a question, it's a statement. If a student already has an IEP, it could be a referral from the school or the IU.
Yes, that's right. Yep. Yep. Good. Really good point. Yeah.
Anything else before we wrap up for the night?
Okay, I'm gonna go ahead and stop the recording. If anybody has any questions that are more specific to an individual that they are supporting, whether it's yourself or a loved one or somebody else, that will allow you an opportunity to ask those types of questions.